Okay, morning guys. Welcome back. It is Thursday. Hope everyone's doing well. Like I said yesterday in our video, MeterX free membership for a month for anybody that needs support. Guys, feel free to utilize it. Okay, dinner last night. These were two filet mignon from Certified Piedmontese. They are a great cattle company out of Lincoln, Nebraska. I've actually been there and visited these guys. They make exceptionally good, high-quality meat that is not only flavorful, very juicy, but for those people that are trying to lean out like I am right now, it's a very lean cut of meat. And despite being lean, it's incredibly well-flavored, juicy, good texture. It's not like eating dry chicken breast, which many people, when they eat their leaner source of protein, tend to do. This is just a little example of our MeterX. We have hundreds and hundreds of direct-to-consumer ranchers listed. So if you want to support a rancher directly, go to our website, sign up as a free member, get access to all that stuff, get access to discounts on this stuff too, guys. We want you to utilize and help these ranchers out. All right, this is Layne Norton made a video talking about some comment I made on the fact that there was a study out of one of the provinces of China saying that people that had coronavirus saw a drop or lower levels of LDL cholesterol. I'm going to talk about that in detail tomorrow because, of course, what he does is conflate what people that are following me say to what I say and misrepresents what I actually said. Anyway, we'll get into that tomorrow. But this is an interesting thing came out. I saw this in my Medscape feed yesterday. It says hospitals muzzle doctors and nurses on PPE in COVID-19 cases. And so what we're seeing is, and I'll just read the article for you guys. And it says, over the past month, an orthopedic surgeon has watched as crowds of sick patients at this hospital has grown while the supply of personal protective equipment for staff has diminished as he prepares for another day of staff testing tents and places one of his one and only mask across his face. He has also received a daily reminder for hospital management, don't talk about it. The surgeon who works in a COVID-19 hotspot in the Northeast spoke on the condition of anonymity for fear of employer retribution. It's very clear, no one is allowed to speak for the institutions or the institution, he said in an interview. We get a daily warning about being very prudent about posts on personal accounts. They've talked about this with respect to various issues, case numbers, case severity, testing availability, and PPEs. The warning means staff at the hospital suffer in silence, unable to share the troubling situation with the public or request assistance with supplies. I have one mask. We are expected to reuse it unless you're exposed or work with a known COVID victim, the surgeon said. However, with the numbers in our region rapidly increasing, you can't assume that people don't have it or that you don't have particles on your mask, even if you're not in a known quarantine zone within the institution. As the COVID-19 health crisis rages on, the online platforms have become a commonplace for health professionals to lament short supplies, share concerns, tell stories, and plead for help. But at the same time, other physicians, nurses, and healthcare workers are being muzzled by hospital administrators and threatened with discipline for speaking about coronavirus caseloads and dwindling supplies. Some worry that the gag orders are muddying the picture of how hospitals are faring in the pandemic while placing the safety of frontline workers at risk. The silencing of physicians by hospitals about PPE shortages and other COVID issues has become widespread, says Nisha Mehta, a physician advocate and community leader who writes about PPE on social media. Physicians are being warned not to speak or post publicly about their COVID-19 experience, including PPE shortages, case specifics, and the percentage of full hospital beds. Dr. Mehta said on an interview, in some cases, physicians have been forced to take down posts or have faced retribution for speaking out, they said. There's definitely a big fear among physicians, particularly employed physicians, in terms of what consequences may be for telling stories. Dr. Mehta said, I find that counterproductive. I understand that not inducing panic, but these are real stories that are important for people to understand, so they do stay at home and increase systemic pressure to get sufficient PPE so that we can preserve our healthcare workforce for a problem that is going to get worse before it gets better. Meanwhile, an Indiana hospitalist who took to social media to ask for masks for the hospital in his area said he was immediately reprimanded by his management after the post came to light. The hospitalist posted on social media platform to request donations of N95 masks after hearing members of the public had purchased such masks. He hoped his plea would aid preparation for the pandemic at local hospitals, explained the physician who spoke on the condition of anonymity. Shortly afterwards, the administrators from the hospital conducted contact the online firearms moderator, and posts were removed. He said during a subsequent conversation, administrators warned doctors must not make such posts about PPE because it made the hospital appear incompetent. I was told we can handle this. We don't need public's help. The physician said I was hurt and upset. I was trying to protect my peers. After landing on the management's radar, the hospital said he was reprimanded a second time about posts on separate social media account. And the second time, the private posts to friends and family were related to COVID-19 and PPE, but did not include any protected health information, he said. However, administrators did not like the content of the post, and he was told management was monitoring his activity on social media, he said. The larger message is that patients are money, the hospital has said. The corporate side of medicine rules out over the medicine side. Imagine making sure there's consistent cash flow trumps all else. Another frontline physician who works at a large New York's hospital said staff have been cautioned not to talk about with the media and be careful what they post on social media regarding COVID-19. The general rule is that only information approved by the administrators can be shared to the physician who spoke on the condition of anonymity. The healthcare system is very protective of its public image, he said. In the past, people have posted things they don't like, get spoken too quickly, and are fired depending on what was written. I can only imagine what would be the situation regarding COVID-19. They're very strict. The frontline physicians who has close contact with COVID-19 patients said he has access to the N95 masks at the moment, but when he requested higher level protective gear, hospital management refused the request and denied that such supplies were needed. Safety of frontline medical workers appears not to be taken seriously, he said at his hospital. Everyone's stressed, but at the end of the day, the administration is sitting there while the rest of us are putting ourselves at risk. We reached out for one hospital for comment, but the messages were not returned. Other hospitals were contacted because the physicians feared they would not contacted because the physicians feared they would face retribution. We also contacted the American Hospital Association, but they did not need to respond. In Chicago, an email by a nurse to her co-workers about the safety of masks has resulted in a lawsuit after the nurse says she was fired for sharing her concerns with the staff. The nurse, Lori Mazurkowitz, sent an email to staffers at Northwestern Memorial Hospital stating that surgical masks provided by the hospitals were less effective against airborne particles than were the N95 masks. According to the lawsuit filed March 23rd in Cook County Circuit Court, Ms. Mazurkowitz was terminated the next day in retaliation for the email, the lawsuit alleges. And it goes on and on. This is another one from Joseph Mandrola, MD, Louisville, Kentucky-based cardiologist, who's written about the recent muzzling of frontline physicians with respect to coronavirus, said he's not surprised that some hospitals are preventing physicians from sharing their experience. For COVID-19, in many hospital systems, there was a culture of fear amongst employed clinicians. He said employed clinicians see other employed physicians being terminated for speaking frankly about problems. It takes a scant few of these cases to create a culture of silence. And it goes on and on and on. So anyway, guys, this is an issue in hospital in general. Administrators, I know as a physician, I was, basically in a similar type of situation with hospital administration, caring about the bottom line of more than the health of the patients, more about the health and the well-being of their employees. That's just the way it is, guys. All right, let's talk a little bit about. This is a good clip, guys. I want you to watch this 2-minute clip from Ky Furneaux. Ky Furneaux is a Australian stunt woman who's doubled for Sharon Stone and a lot of the famous actresses. She is a alumnus of Naked and Afraid a couple times and several other survival shows. She is a survivalist. She was a 20-year vegetarian. She talks about her account of going on Naked and Afraid first as a vegetarian and then coming back on the show again on a carnivorous diet. So take a listen, guys. I think you'll appreciate this.
15 years of being a stunt performer, and I can't remember getting out of bed going, I feel great. Whereas now, no matter what I physically do to my body, I don't even have lactic acid build up the next day, and I contribute that completely to the meat diet.
Ky, it just continues to get more interesting. I don't know, Zach. I want to, I guess 2 questions. Well, one, when you're out and Naked and Afraid, and I've seen a little bit of that show. I don't really have a TV, so I can't really watch. I watch a clip here and there if I'm on a hotel room and it happens to be on.
Yeah.
That was like one, it kind of sucks because it wouldn't be very fun. But 2, what, as a vegetarian, I mean, did you stick to vegetarian when you were in the show, and how did you friggin' survive? Or were you eating reptiles? And then I want to delve, and I'm sure Zach, because we had a private investigator on the other day, and we're like, well, hell, I don't know anything about private investigating. Let's ask questions. So I want to ask you questions about stunt woman stuff, and let's get some of the behind the scenes on that, because I'm sure both Zach and I are both curious about that. But tell me about what the hell you ate on Naked and Afraid as a vegetarian, or how that turned out. And then let's get into the stunt woman stuff, and then we can progress.
Well, this was probably the time when I realized that meat was really good for me, was doing that 21 days on Naked and Afraid, because, I mean, it's really hard to discern the difference between poisonous vegetation and non-poisonous vegetation. Like, you really have to know your stuff out there to be knowing what mushrooms to eat or what berries to eat, you know, but pretty much if anything moves and you can kill it, you'll eat it. So there's that makes being vegetarian extremely hard out there, because the things that you know you can eat are going to be all animals. So I remember the moment we killed this nutria, which is like this beaver rat combination, and it was probably the first meat I'd eaten in, I don't know, say 15 years, and I put that nutria in my mouth, and it was almost like I could feel the difference it made to my body immediately. I was like, holy cow, and the energy, and it just felt like I was actually putting the nutrition my body needed into it. So that was probably a defining moment on that first Naked and Afraid. And then I went straight back to being vegetarian, and that sort of went downhill again. But for me, like, I just did another 21 days on their new concept called Alone. So I was 21 days alone in the Amazon. Again, I lost 10 kilograms. The first thing I had when I got out was a pork chop, and I just went straight on to meat. And I was training the day after I got home, and then did another TV show where I raced a guy in the Tibetan plateau 2 months later. So I recovered from this same experience in a day and a half, as opposed to 2 years. So that to me is when you go, well, you know, like this meat thing is the way to go for me, for my body.
Okay, that short clip is from our HPO podcast, Human Performance Outliers podcast. I'll link it in the description below. It's an excellent interview. She also talks about having a diagnosis of hemochromatosis. She had, as a younger person, went on a vegetarian for years, continued to get worse and worse and worse. And guess what? Going on a carnivore diet alleviated her hemochromatosis symptoms, normalized her iron, despite eating all that iron from meat. So it's another interesting interview. And then she goes in all kinds of detail on stunt acting and the survival shows and that stuff. But interestingly, like I said, it took her 2 years to recover from the first Naked and Afraid as she went back to vegetarian. She goes on again, and then she's basically essentially recovered back to normal activities within a day and a half, because she started eating meat immediately. So that is an interesting, you know, case-by-case experience on one particular person who goes vegetarian, big stress to the body, can't recover, takes 2 years, to big stress on the body, eats meat and recovers almost immediately. We see this time and time again. You know, check out this soccer player from Europe. Guy can't get healthy on a vegan diet. Vegan is a poor choice, particularly for athletes, particularly for people undergoing stress. All right, you guys stay safe. You know, keep your heads up. If you need support, please join us for free at meatrx.com. I'm about to go live with my man Tristan Haggard over at MeaterX on our daily meeting at 9 a.m. I do a meeting every morning at 9 a.m. Pacific time. Join me. Get in there, live video chat, guys. All right, guys, stay strong. This is a time to get stronger, not scared, not weak. Get stronger, okay? There's no reason you guys can't, you can't just get after it. All right, see you tomorrow.